Welcome to Therapy Unpacked while holding the line, brought to you by Got Your Six Counseling. I'm Brittany, trauma therapist, law enforcement veteran, and first responder ally, and your trusted guide through the wild world of mental health without the fluff and without making you sit in a circle and talk about your feelings, unless you want to. This podcast is all about unpacking the stuff that weighs on us: stress, trauma, burnout, crappy sleep, messed up relationships, and all the shit we shove down deep and keep moving on with. But here's the deal. You can't hold the line if you're falling apart behind it. Whether you're in or out of uniform, behind the badge, riding the rig, or just trying to figure out why you snap at your dog when the coffee runs out, you're in the right place. We'll break down therapy concepts in plain English, with maybe a few dark jokes along the way, and give you tools that you can actually use. No kumbaya or hand-holding required. Just a quick heads up before we dive in. This podcast is for informational and educational purposes only. It's not therapy. It's not a diagnosis, and I'm secretly not your therapist just because you're listening. If you're struggling or need support beyond what we talk about here, go ahead and hit pause and reach out to a licensed mental health provider in your area. Seriously, therapy is cool, okay? So take a seat, grab a snack, and let's talk. This is Therapy Unpacked while holding the line. Hello, and welcome back to Therapy Unpacked while holding the line with Got Your Six. I'm Brittany, same host as before. Today is episode 3, or this is episode 3, titled A Quiet Weight, The Ones Left Behind. I want to start with a slight trigger warning. We're going to be talking about suicides and line of duty deaths and things like that. If this is not your jam, maybe we sit this one out, or I just want you to know going in that we're going to be talking about some of these things and that it can get heavy and it might be emotional or triggering. And so I just want people to know that this is what we're talking about today. So we're discussing survival's guilt, generally speaking, mourning, losing someone to suicide, and the moral injury that occurs there for a lot of people. So we're just going to jump right in. First responders, law enforcement, even military individuals and their families a lot of times sit with the constant worry and fear and anxiety that like something might happen to their loved ones, something might happen to themselves. And then even in the first responder community, witnessing calls directly that can risk trauma, have relationships in general, friendships, whatever, where someone could potentially die unexpectedly or even commit suicide. In Virginia, this was a study that was done. It says 1 in 4 first responders report work-related depression and 8% report thoughts of suicide. I feel like that is probably low, but I guess for the whole state of Virginia, in terms of like numbers, it's probably not. Behind these numbers of people who have depression or report thoughts of suicide will be the ones left behind if it gets to that, and then the people that worry about them. So I think if anyone has lost someone to suicide, whether that be a family member or a friend or a wife, a husband, a child, whatever, right? Especially, I would say, line of duty type of situation where you are doing your thing and your partner or someone that you know that you work with has committed suicide. That can cause a lot of distress for the people that are left behind because there are lots of questions, right? Like, could I have done more? What if? What if I had noticed sooner, right? These are all very common, normal reactions to losing someone to suicide and being one of the ones that are left behind, right? It presents a moral injury that is separate from PTSD, but together they are a dumpster fire of emotion, right? That can compound the grief, not just the individual, the family system, but like everyone involved, right? So I know that we said in our main podcast that we were going to talk about moral injury in a more defined way, but I feel like here we also need to have a discussion about moral injury because people say it's very much a buzzword, but I don't know that people really truly know what the actual definition is and what it consists of, right? So moral injury is where people feel like they have caused or failed to prevent things from happening that is not in line with their deeply held moral beliefs or expectations, right? We could have a whole episode on just moral injury, But in terms of this little podcast that we have going on, we're talking about how suicide affects us. Like, maybe you don't agree with that. Maybe you think it makes them weak. Maybe you have your own beliefs about suicide and the way it goes and why people do it. But I can assure you, when things don't, but that's because it doesn't sit with your moral belief, right? So like, you've crossed the line with respect to your moral beliefs. Oh my gosh. Guilt, shame, disgust, anger, all of these emotions are in line with moral injury, right? Okay, so let's pause there for a second and talk about guilt and shame, right? They're not the same. Guilt is the self. Let me go back. Guilt is about behavior, right? Did we do something that we should feel guilty for, which would then result in an apology or making things right? That's guilt, right? Shame is focused on the self. It's focused on identity. It's focused on me kind of internalizing this situation. It generalizes the whole self, right? Like, I'm bad because of what I did. I'm bad because of what I didn't do. You actually didn't really do either of those things, right? Like, the shame is about you, where guilt would be like, I did something bad, right? It's all about the bad emotions, right? Where shame is very different. I hope that makes sense. So there's a lot of it's a moral injury, and there's a lot of guilt and shame that surrounds it, right? And then the disgust may occur when you're having memories or you're thinking about like how it happened or why it happened, or it also like links to like feeling betrayed. So maybe someone has completed suicide, and you feel like they betrayed you by doing that, right? Or maybe whatever they were doing in the process of that was a betrayal in line with your moral beliefs. That's all fine. Moral injury happens, and it coexists with PTSD all the time. It doesn't have to be, right? You can have a moral injury without PTSD, but a lot of the symptoms are similar, like the distress from the traumatic event itself, things that follow. Moral injury doesn't include like nightmares and flashbacks and stuff like that. That's very PTSD-esque, right? Moral injury is the feeling associated with what happened and the guilt and shame that's associated with it because of your moral beliefs and expectations based on theirs, right? So it's important to recognize that like feeling this way, guilt and shame, all about that, it's normal, right? Especially when someone commits suicide, right? Because we are left with lots and lots of questions, and it is grounded in a lack of control, right? If I just knew sooner, if I just knew, I could have done something. Maybe you could have, maybe you couldn't have, right? No one has that much control over someone else's life, right? If people are suicidal and they're going to do it, they are going to do it unless someone intervenes in a way that is, I don't want to say clinical, but they have to tell you that they want to do it. And if they're not telling you, then how would you know, right? That shifts to like, I did the best I could or whatever, right? It's normal to have these feelings, right? The way that you experience grief and loss impacts your ability to process it. And it's such a cringy thing to say, right? Where people are like, oh, everybody grieves differently. Healing is not linear. Those things are true. As cheesy as they might sound, they're not. There are, I think I counted one time, it was like 12 or 13 different types of grief in the way that we experience it, right? Depending on the way that person died or the way that you handle it. So grief and mourning are another two terms that are used interchangeably but are not quite the same thing, right? Grief is the internal experience that you have following a loss that is your emotions and like inside feelings, right? Body felt sense. That's the sadness, that's the anger, that's the confusion. That is grief. Like just handling the loss and dealing with it in that way is everything that you feel internally. People don't witness your grief in the same way that you feel it, and that's called mourning. When they say so-and-so is in mourning, that is their objective experience of what you're going through following your loss and while you are in your grief, right? It's you see people in mourning at funerals, but they'll be grieving for years, right? It's a very internal experience that's not always seen on the outside. But the way that you experience grief, loss, death, maybe you've never experienced it, maybe you have, all impacts your ability to process it. Avoid comparing yourself to other people when it comes to that, the way they're handling it, the way that they've conceptualized it, because everybody's not the same, obviously, and we all process losses like that very differently. Does it help to sit with other people that are experiencing the same thing as you? Sometimes. Maybe it works for you, maybe it doesn't. This is a situation where you're going to do what works for you within reason, right? We're going to dip our toes into that in a minute. But we're going to do what works for us in reason, whether that means you're going to take time for yourself, you're going to take time off from work, you're going to seek help, finding a therapist, going to a support group, reaching out to, peer support to move if it's bad, right? Like you can move even further and go, there's lots of levels of care, right? Noticing and having the insight that you are struggling and having a hard time with this is number one. How much is it impacting you? Number two, right? Are you having all of these really deeply felt sense of grief and loss and maybe having thoughts of suicide yourself? Maybe you're very depressed. This is the time. This is the time for you to reach out to someone. And maybe it also is in line with the fact that, like, in this community, we don't talk about those things, right? It's very stigmatized. We talked about that in episode 1, where it's very stigmatized to reach out help, and maybe that makes you weak, or maybe it doesn't make you as good of a, first responder, firefighter, paramedic, law enforcement, whatever, right? Maybe that gets into your head and makes you think that maybe you shouldn't be doing that work, or maybe you're not. Humans were never meant to see and deal with the things that we do see and deal with, right? In terms of this. And grappling with the loss of someone, whether that was suicide or even a line of duty death, is very difficult, because if you were directly involved in that, you definitely have a moral injury, probably, most certainly, about that situation, right? Because there is lots of questions about why this happened, or this shouldn't have happened. He was young, he had a family, or she was young, she had a family, whatever the case. Knowing how you process grief and seeking out someone who can help you is so important to overall healing. So we talked about peer support groups, but also therapy with a trauma-informed provider, right? That doesn't mean me. It doesn't mean any of us here. You can find trauma-informed providers all day long on the internet, making sure that they fit in line with what you need. And maybe they don't. Maybe you need someone specialized. That's fine. Find it and keep looking until you find someone that you're going to be able to connect with and be able to share these experiences in a way that you feel like you don't have to censor things. That's one of the things I love about doing this type of work and working with you guys. I say you guys, you population, my veterans, my first responders, everybody. Because there's nothing you can say that's going to shock me or scare me or upset me or whatever. These walls have heard it all. So go find somebody that you can talk about exactly what happened, the way that you are comfortable with doing. That's not going to shun or shy away from what you're saying because it makes them uncomfortable. That's a problem. That's a red flag, okay? If you have questions about red flags, go see our Red Flag in Therapy podcast. I cannot tell you what episode it was, but we talk about a lot of those things, right? Things that you should be like, ooh, this doesn't feel right. It's probably not right. You know what I mean? Also, moving through some of this stuff is having structured routines that fit your daily life. Whatever you were doing before, maybe that still works. Maybe it doesn't. Maybe you need a change. Cool. Write one down. I always tell people to write down what they're doing already. Write down what they would like to be doing and see where the deficits are. Right? Maybe this loss has shaped you and transformed you in a way that you have to just change up everything. That's okay. Do it. If you think it's going to help you and you're talking to a therapist is like, sure, go ahead. What we do want to avoid is numbing behaviors, like isolating, throwing yourself into work, this overworking thing, because if I'm working and I'm constantly busy, then I don't have to think about the way this feels. That's repression. We're pushing it down. and we're numbing out. And that is where a lot of people bump up against that wall of like, well, I can't process this. I'm still feeling this, but you're not allowing yourself to feel it, right? It is painful. It's going to be painful. But having someone who can sit in the space with you and help you process that pain is one of the most important parts of that, right? That we can help you navigate through it. Let's not be drinking a whole lot and doing a bunch of drugs and going out and doing a bunch of risky things. I'm not, what's the word I'm looking for? I'm not throwing shade. And I'm not saying if you do drink alcohol or whatever, that I'm saying you're bad. I'm not saying that, okay? I'm saying that their coping strategies are maladaptive, meaning that they're not good. They don't help. All they do is hinder you and keep you back, keep you numb, keep you isolated, right? Makes you more depressed. Alcohol is a depressant, and people who drink that know it. Maybe they don't have the insight now, but they will, right? Relinquishing control of it. You have very little control over the things around you. And a lot of people, I feel like, probably don't fully grasp that, right? Like, control makes us feel safe. Control makes us feel less vulnerable. But there are a lot of things that you just can't control. And if you really sat down and looked at it and thought about it, really the only thing you're controlling is yourself, right? You can control yourself, how you react, how you feel, all those things. Maybe not even how you feel, depending on the situation. But you can't control other people. And maybe in these situations, it doesn't matter how much you knew or didn't know. I'm having a hard time with words today, and I'm so sorry. You didn't know what was going on or what their plan was or whatever. That was by design. Because if you knew as a friend of someone who committed suicide that they were going to do that, you wouldn't have allowed them to do that. And that goes against their belief and expectation and desire to do that. Can we intervene if we know? Absolutely. They're going to be mad at you. They're going to be mad. They're mad at me. They're mad at us when we have to take those steps. But their need and want to desire to die, or their suicidal thoughts, is in direct contradiction with my ethical code and, like, do no harm. I don't want any harm to come to my patients, right? And they will straight up lie to your face and say that they're not suicidal, or that they're not thinking about it. And that maybe they don't, but maybe they are, because they know if I knew, then I would have to take steps, both ethically and legally, and because I don't want them to die, to shape that, to change it in a way that might be better. Maybe they stay suicidal. Maybe they don't, right? Unless you know, you can't know. And relinquishing control of that and not getting so focused on finding a reason makes us feel less vulnerable. I don't know if I said that right. If you need control, it makes you feel less vulnerable. Finding a reason for this traumatic event, whether it's a line of duty death or a suicide, gives us the feeling of less vulnerability, right? If I just knew why, if I just knew that things could have been different, or what if this or what if that, then you can anticipate other experiences in the future to go the same way and for you to react the same way. But that's definitely not always the case, right? You always got to look for a reason. We may never have a reason, right? You may never have an answer. Finding closure can be very difficult for people because they need that control. They need to not feel vulnerable. They can't feel what they're feeling because they've numbed it out. They've pushed it down. They will not grieve. And I'm telling you right now that not grieving, if you're feeling it, because some people move through very quickly, by not grieving, you are making long-term adverse effects for yourself, right? Grief can manifest in a variety of ways the same way that trauma can. So it's very important to, I don't want to say focus, ruminate, hyper-focus, any of that. It's very important for you to sit with it and feel it and do that in a place that feels safe for you. And knowing that there was likely nothing that could have been done, because this is very much a moral injury for you, so you feel like you should have. There probably wasn't anything. And if you've ever been suicidal yourself and can relate in any way to the people that have passed away, however you phrase it, then you know what it's like to be sitting in that space that they were in before. and how difficult it is and how vulnerable it is to ask for help and how scary it is. Inpatient hospitals are scary sometimes, okay? Like, you lose all control of things. Some of them, they're all very different, but some, are very secured and some are not. And so you're handing over as an adult or even as a teenager, whatever that looks like for you, the control of your whole being when you sleep, when you wake up, when you eat, when you go to the bathroom, all these things. And so that can feel very scary for people, but the end result is a much more stabilized human with access to mental health resources they may not have had before. I say all this to say that it is a quiet weight and it is heavy. Grief is heavy, and whether you've never lost anyone or you've lost 25 people in your young life, the way that you process it is so important, and avoiding it does you no favors. You can carry grief and move through it in a way that is safe and comfortable for you. I will have people that come in and maybe they've lost someone, maybe they're grieving, maybe it was awful in terms of like a suicide, or, even, I'm gonna say worse, but like maybe it wasn't their own choice. They weren't sick, they died suddenly. There's no pressure from me to talk about that. Sure, you came in for that, and I'm gonna write that down, and we're gonna have a conversation about the way it's affecting you. But after that, it's very much like, what's happening? How's it going? How are we dealing, right? There's not this constant pressure to talk about the grief that you're feeling or the loss or the incident or anything like that. Finding someone who you can talk to about stuff like that, and that's just going to check in on you and be supportive of you, is like a pillar for processing grief and loss. So just know that when you lose someone and you're one of the ones left behind, whatever that looks like, maybe someone died in combat, maybe they committed suicide, maybe they were killed in a way that was not combat related, maybe they got sick and died and you only just found out about it. You didn't know they were sick. Any of these equal to that, right? There's a moral injury, maybe a PTSD diagnosis down the line. If you don't have one already, it's okay to ask for help. It's okay to give yourself grace and say, this is really hard and I'm struggling right now. I want to so bad normalize that instead of normalizing the isolation, the numbness, the over-functioning, because that does you no favors. So if you need help, support is out there, right? We've talked about this so many times. Psychology Today, Therapy Den, your insurance. You guys, if you're local, could reach out to us. If not, reach out anyway. We can help you find someone, right? This podcast and our work and my drive into being in this field is that I want to normalize this. I normalize this in terms of like people getting help and knowing that it's, that it's mostly normal to feel the way you feel about all the situations you're feeling because no one talks about it. Going back to work and hyper-focusing and over-functioning just pushes it down. It just numbs it out. And the alcohol, drugs, whatever, all that is the same thing. It is a coping strategy that's not working. Let us help you find something that can, right? Find a new routine. Put down the alcohol within reason. I'm not telling people that are drinking to stop quitting, to stop drinking, because I'm not one of those people, okay? I'm not a doctor. I can't say you need to stop drinking and you're not going to have any. You need to talk to somebody about that. If you're a heavy drinker, you need to reach out to someone about that if you are motivated to do so, about what that looks like. Maybe that means detox. Maybe it doesn't. Again, not an expert. So I hope this was helpful in terms of grief and mourning and moral injury. Just a little tidbit, right? If you stay tuned to our main podcast, Peggy and I are going to be talking about some of these things way more in depth, right? This is just a little snack, if you will, about these things to kind of keep you guys on track, up to date, and also just to normalize the shit out of it, right? People lose people every day in one way or another, And the people around them are impacted by that loss, whether it was traumatic or not. Find someone who can help. We can help. We can help you find someone that can help. It's normal. You're human. You're not a robot. Be kind to yourself. And I'll see you on the next one. Thanks for listening. I want to thank you for tuning into this episode of Therapy Unpacked. If something at home made you think or just helped you not yell in traffic for 20 minutes today, let's consider that a win. Make sure to follow, subscribe, or do whatever your app calls it so you don't miss future episodes of Therapy Unpacked and our main event podcast titled Holding the Line with Got Your Six, now streaming on YouTube, Spotify, Apple, and other platforms where podcasts are available by searching Holding the Line GY6. If you know someone else carrying a heavier load, feel free to share this with them, because we're all in this together and no one should have to go through it alone. Until next time, stay grounded, stay human, and remember, it's not weakness to reach out for support and unpack the shit you've been carrying. In the words of someone wiser than me, go forth and do magical shit, everyone.